Good evening, good afternoon, good morning, wherever you are in the world. Today we have a fantastic guest, a really fascinating guest who I've met at conferences, if you will, hypnotherapy conferences that I've presented myself. I've met him before, and he specializes in hypno oncology, which is a really fascinating area. We're in for a really fascinating talk today because Garry Coles, we're going to bring into the conversation shortly, specializes in hypnotherapy, hypno oncology, and he's going to tell us more about what he does, which is really intriguing. And whenever I speak at conferences myself and I look to see how Gary's doing, the room is always full, so he must be doing something right, that's for sure. So Garry, thank you for coming on board the show. Tell us a bit more about how you got into hypno oncology and what it is for our viewers.
Yeah, hi Jimmy. No, nice to talk to you, and nice to see you again, even virtually.
Absolutely.
Yeah, I mean, hypno-oncology, or to put it more specific, people say, what is hypno-oncology? Hypno-oncology is essentially the use of hypnotic interventions for the cancer journey. It's important to say that we do not treat the cancer itself. It's hypnosis for the cancer journey, but I'll come into more of that later. My background in it, again, was slightly accidental. I mean, I have been through the cancer journey, not personally, but sadly, I lost my mother at quite an early age through cancer. I've nursed my grandfather through it and things like that. So I've had exposure on the devastating effects that it can cause. But my hypnotherapy journey was I decided to become a hypnotherapist, and even that was accidental, if you like. I became a hypnotherapist, and after I first qualified, I needed more experience, as we all do. Now, somebody had spoken to a local hospital who had a unit, a complementary therapy unit in their cancer centre there. And they phoned me up out of the blue and said, we just understand that you've qualified as a hypnotherapist. Would you come down and do some work at the hospital as a volunteer? So I thought, from a mercenary point of view, I thought, well, I need the experience. I'll go and volunteer some time. I'll do a couple of weeks because they were offering me 8 patients a day to see. I thought I'll go for a couple of weeks, gain experience and disappear. Now we're up to nearly 15 years later and I'm still there. I now only do half to 1 day a week. But in that time, I've probably seen, well, I've seen around 10,000 patients, but 2,000 patients have been exclusively cancer patients. So I've got a lot of experience in that background. Now the hospital are very sort of future thinking, so they have this complementary therapy unit which includes hypnotherapy or hypno-oncology for the cancer patients, and it's moved on from there because I've worked with so many cancer patients over the years. I've seen the journey sort of firsthand many times, so I've been able to develop specific approaches and specific techniques and test them that I think work very well with cancer patients. On top of that, the hospital have sent me on lots of specialist cancer courses over the years. And also from then, I decided I like to take everything to its sort of nth degree. And I was on the first cohort in the UK of people that actually studied for a master's degree in clinical hypnosis. Now, I decided when I was doing that, I had to do a thesis and some research. And I decided to make it really difficult for myself. And I decided I wanted to do medical research. And I then become embedded in the breast cancer multidisciplinary team for a year at the hospital. So I was attending all the surgery meetings, all the diagnosis meetings, the oncology meetings. So I learned a lot about the first-hand, the journey and the diagnosis and the treatments. And what I actually did, I ended up publishing my thesis on that. I actually did research into pre-surgical hypnosis and the effects that it had on the recovery quality in breast cancer operations. And I was able to demonstrate that it actually did have quite a positive recovery, both psychologically and physically. So that was very good. That then gave me more of an in with the doctors and the surgeons because they were seeing the work that I was doing and they were seeing the results. Up to the case where I was very lucky. I had one surgeon that had actually experienced as a trainee. He'd experienced an operation that was done under hypnosis rather than anaesthetic, so he was very much on side from the start. And I had one very anti surgeon who gave me such a hard time at the beginning, but then after a few weeks come to me and said, oh, if you want me to move my elective list around to accommodate the patients you want to see, let me know. I'm quite happy to do that because I've seen your results. So that was very good. I got them all on side and they were seeing the results and everything worked very well. So that was my sort of original journey into hypno-oncology. That then sort of moved further on in that I had the chance to do a couple of talks like we are today with people who were just interested in what I did. That then caused me to get emails from sort of people all over the world because I did some international ones as well as UK ones. A couple of people suggested to me that I needed to put a course together on Hypno Oncology to teach hypnotherapists how to work specifically with cancer patients. And I must admit, my initial thought was there's probably no call for it, rather stupidly. And then really it was about 4 or 5 years ago, I was offered the chance to speak at the inaugural UK Hypnosis Convention. And that obviously went down well because I've spoken every year since. Then that caused some traction, so I ended up speaking at Hypnothoughts Live, which, as you know, is the biggest hypnotherapy conference in the world, out in Las Vegas. And since then I gave in, and I actually put a course together to teach hypnotherapists to work with cancer patients. So I've done a few in the UK. Then I've been asked to go out and do some teachings in the US, and that I actually ended the last year with I was invited out to teach in Bahrain.
Fantastic.
And now we have hypno oncology practitioners all around the world that can work with cancer patients and also teach, and that's sort of becoming exponential. I mean, there are training courses set up for this year for the UK, for Europe, the US, Canada. So it's just moving all over the place. So it's sort of taken on a life of its own now.
Yeah, that's fantastic, Garry. It's really fascinating. And just for our viewers wondering what you do in terms of, you sort of mentioned, obviously, you're not treating the cancer itself. So just for our listeners, in terms of understanding, you've got a vast amount of experience in doing the work. Now, sort of what do you do in terms of the work? Obviously, you're respected by the people you're working with, the medical people, which is important to have that. But what do you do in terms of process, and what are the areas that you work with in terms of, say, someone is diagnosed or currently diagnosed with cancer? Where do you come in on the journey, so to speak?
Okay, well, actually all parts of the journey, but what I'd like to do to start with sort of is give some more background really of why this is an area to get into, and also some of the stuff that we can do, and also about the ethical side of it, because I'm very particular about ethics, because unfortunately people going through the cancer journey are very desperate in a lot of cases, and I've seen firsthand on the internet and all sorts of sites very unethical people that just want to take money from them. And that's a very big thing that I'm anti. But the reason that I started getting into this is people don't realise quite how big cancer is in the Western world, and statistics are actually quite frightening in the fact that now in the Western world, 1 in 2 people born since 1960 will be affected by cancer at some time in their life, which is quite a frightening statistic. 1 in 7 women will get breast cancer, 1 in 8 men will get prostate cancer. Bowel cancer affects 1 in 15 men and 1 in 18 women. Lung cancer affects 1 in 13 men and 1 in 15 women. And interestingly, where hypnotherapy or hypno-oncology comes in is there's some research done by SAGE, a quite respected research body, that actually show that 40% of cancer sufferers will actually seek out complementary therapies at some time during their journey. So theoretically, that's 20% of the population that could be looking for therapies such as hypno-oncology.
Yes.
So we looked at that, and so hypno-oncology, the first thing is, as I mentioned before, is we do not treat cancer. We use hypnotic interventions for the cancer journey. One of the reasons we do that, A, it's unethical, and B, in the UK in particular, and in other countries around the world, there is regulation on why you can't work with cancer patients. In the UK, we have the 1939 Cancer Act, and that is there to say that unless you're a qualified surgeon, doctor, oncologist, you cannot claim or actually even do work with the cancer itself. You cannot claim to treat, to remedy, or work with it. However, you can work with cancer patients. And the reason that the ethical side of that is quite important is people that have got so many misconceptions. I mean, statistics that I've seen recently, which are quite worrying. The American Society of Clinical Oncology did a recent survey with 4,000 adults, and 25% of those either had or did have cancer. And the results were staggering. 40% of them strongly agreed or somewhat agreed that cancer could be cured by oxygen, diet, and herbs alone.
Wow.
And half of them, under the age of 53, thought that cancer could be actually cured by complementary therapies alone. Now, what's worrying about that is that if you seek out just alternative therapies, it actually doubles the mortality rate. And if you actually look at early stage cancers, that increases the death rate by 6 times. So I think it's very important that we get that out there, and we're very ethical with that.
Yeah, definitely. I mean, that sort of strikes me about your work, Garry. The ethics, and I think it's really important because people who have cancer can be vulnerable, like you've mentioned, to look. And there's a lot of fads out there, and even on the internet, people make these ridiculous claims. But equally, in saying that, that sort of memory, I don't recall the paper I was reading one time. I was doing a dissertation in the area of mindfulness, and I recall that there was a paper. If I can find it somewhere, the top of my head, I might have it on file somewhere. It was a paper that talked about exacerbation of symptoms,
Yeah,
where, for example, if you've got like not just cancer, this was related to sort of various conditions where it talked about how certain therapy could be useful in the exacerbation. Obviously, sometimes we can really focus on what we can't do anymore and the pain that we're in, and we know that hypnosis, for example, there's evidence around hypnosis being useful pain relief, and I would imagine if we've got cancer, would some experience a degree of pain. So I can see it from my perspective being potentially useful around the area of, say, helping with the way we exacerbate, where sometimes, obviously, you've got life plans, you've got your whole life ahead of you, and to be given a diagnosis like that, God forbid anyone, gets that, can be obviously psychologically can spark a number of things. You can have the sort of comorbidity around depression, anxiety. I'm not sort of suggesting that's what you treat. What I'm saying is how sometimes it can be obviously derail people, but also pain relief and areas like that where hypnosis has got evidence to help people. Am I right in saying, is that some of the things that sort of people come to you to help with, maybe just generally day-to-day perspective and pain relief?
Yeah. Well, interestingly, again, coming into looking at research and things, because again, I come from a very scientific background. All my techniques and approaches have been very empirically tested. That's where I come from. Pain control, hypnotherapy, interestingly enough, with all the research out there, hypnotherapy is the most widely used complementary therapy for pain control. The research shows that. There's a multitude of research papers in that. Homing in more into cancer itself, there was a 2003 study of 57 random control studies of palliative care hypnosis by Flammer and Bogarts, and that concluded that hypnosis was really effective for many disorders that cancer patients encounter. And there was a more recent research just in 2017 by Sharma, and that was a literature review of 55 papers looking at the clinical benefits of hypnotherapy with cancer patients. And again, that concluded that it appeared to benefit cancer patients both physically and psychologically. And again, where I've gone with that is, we mentioned we don't treat the cancer itself, but we do everything on the journey. So we would start, if you like, with the initial aspects of the journey. People come in, they get diagnosed. So there's the anxiety, there's the depression, there's the worry, all about the diagnosis, what's going to happen with the treatment, what's going to happen with my surgery, what's going to happen in the future. So we deal with all that aspects to start with. Then we can deal with the fears and the phobias, because quite often people will have things like fears of needles, fears of going into scanners, fears of surgery, blood, all that type of thing. And again, we know that hypnotherapy approaches and NLP approaches are very good with fears and phobias. There's a lot of work for pre and post surgery. I did my own research that we talked about with pre and post surgery, and was able to demonstrate that there would appear to be a faster psychological recovery from surgery, but also less pain perception. And interestingly, not only was there less pain perception, on actually investigating further, we found that the people that underwent hypnosis or pre-surgical hypnosis actually had less pain medication being given to them, as well as perceiving that they were in less pain. So that was very interesting. We work very heavily with side effects of treatment, and there are a lot of cancer treatments. There are a lot of side effects with chemotherapy, radiotherapy, and the other approaches, and they can be things like nausea, sleep issues, eating issues, vertigo, all those types of things, and we can work with all of those. That again are very common areas. But we also look at some experimental areas, such as the big one, which is very interesting, where there's a lot of research. There's an area, psychoneuroimmunology, PNI, I normally call it for short, because you tend to trip over it if you say it too many times. And that was coined in 1975 by an American Dr. Robert Ader. And that was really the study of looking at the evidence of the connection between the immune system and people's feelings and emotions. And it was able to demonstrate that the immune system could be changed and altered by stressors and so on, anxieties and stressors, but then equally it could be changed by people's perceptions and changes to that. And there's been a lot of work on that, a lot of experimental work, and there's a lot of evidence that we should be looking at a more holistic approach with cancer patients, particularly in the areas of psychological well-being and social care.
Absolutely, that's a really good point you make there, Gary. And I've seen that paper, and also the way we see the immune system now. I'm not a medical person, by the way, but at least on my own journey of study, I've studied for a number of years across a broad range of areas in the field of psychology and neuroscience. I'm still studying now, and in my own journey, some of the research I've seen is quite fascinating about the immune system, where the blood-brain barrier and stuff like that, where in years gone by there was also nothing could penetrate the blood-brain barrier, and inflammation being a potential cause of things like depression and so on and so forth. But I find that really fascinating. It's an area that P&I is an area that I find fascinating. It's an area that ironically, having spoken to you now, I may pursue in the future. I'm not sure at the moment. I've sort of got things on ice, but it's really fascinating stuff. I think it really is. The work you do really fascinates me, because you work with so many people over a long period of time. And in your own journey, Gary, I mean, it's one thing sort of learning. Obviously, we all learn in the classroom to a point. But it's not until we sort of experience. I remember years ago, there was an extract from a book I wrote. I can't remember who wrote the book. I think it might have been Jay Haley on Erickson. He talked about how therapies done outside the therapy room in lived experience. And what I find really interesting about the work you do is, obviously, people are coming to you with all sorts of emotions, and they're going to have a sense of trauma. One would think they're going to have a sense of the genes that they have, obviously going to be potentially expressed in various ways, and the comorbidity of cancer, like you mentioned, anxiety, and over a period of years, in terms of when people come to you, what's the general? I mean, there's no typical the same, but what's the general reaction? I mean, just having someone in their corner, I think, is a big thing to sort of talk to and sort of to work through things. But when people come to you, Gary, in that environment you're in, what sort of state are they in, generally speaking? Is it sort of, do they go through phases of almost like a bereavement in terms of their life, and almost metaphorically in terms of they're coming to you, and there's going to be a vast reaction? It's like no two people are the same. Obviously, it depends on their age, depends on many variables. But how do generally people sort of react when they come to yourself to do some work? What's their sort of general state that they're in, and how do you manage that?
Again, it varies greatly depending on what position or what part of the journey they're sort of getting into, and their emotional state at the time. And there's one area that I teach in Hypno Oncology is very, very fast interventions, what I call emergency Hypno Oncology, if you like, because you might get somebody who is just been diagnosed, so that will cause them straight into an extreme anxiety and panic attack. You might have somebody in fears and phobias. Quite a common one you'll find is that a lot of people don't realize that if you've got head and neck cancers, you tend to have radiation, but you have to be very, very still. So they actually cast a mask of you, which basically has two little eye holes, two nostril holes, and you're actually bolted down to a table to receive the radiation. And from a claustrophobic point of view, that freaks an awful lot of people out. So again, you're dealing with both those scenarios where you've got somebody that might be needing urgent treatment now, and they're having full-blown anxiety and panic attacks and things like that. So they would be very distressed, and you need to stabilize those, and you need to stabilize them quickly. And you get other people that are going through the journey. So you'll get ones where they're looking at surgery, so you're doing pre and post surgery work with them, so you're just trying to prepare them. So that's quite a generalized but quite a calming thing. And then probably the biggest area that I work with most of all is probably side effects of treatment.
Wow.
So that would be from whether it's chemotherapy, radiotherapy, immunotherapy, and so on, because each type of treatment has a range of side effects, some more commonly than others. Obviously, probably the most common one tends to be things like anticipatory nausea, sleep issues, taste issues, eating disorders, those types of things. So those are other typical things you'd work with. So you'd work on those slightly longer term. And then sometimes it's also a wake-up call. Sometimes you'll find that people will be going through the cancer journey. They come out the other side. Obviously, it goes in two ways. We have ones that come out the other side where it's very positive. The outlook is very good. There is the other side of it, unfortunately, we have to deal with, which is the palliative side of it, which is quite hard for people to accept. And again, you have to be very careful as a hypno-oncologist getting into this area, because it can be quite sad. You do lose people. You do form bonds with them and relationships with them, and you do lose them. So you have to be very, very aware of that type of thing. So there is that palliative element about it. But you'll find that the ones that have the positive areas to the journey, then perhaps they would start looking at other life changes. They might have had drinking too much before, or things like that. So they will start addressing particular issues to then improve their life moving forward. Which is quite useful, and some just go on to full-blown sort of mad things that are absolutely crazy. I mean, I've got one success story that I worked with recently, and I know that obviously for client confidentiality I can't give any names, but I know this particular lady's writing a book, so it may become public knowledge anyway. But I worked with this particular lady sort of over the last couple of years. She was in her early 30s, but a very sporty person, very daredevil type person. The first time I saw her was for pain control. She'd actually been diagnosed with a type of cancer, or a colon cancer. They decided it was keyhole surgery. She'd have that done. Everything would be fine. They went in there, found that it had spread much further than they thought. They had to remove the entire colon. They broke most of her ribs getting to it. Did a lot of damage sort of to getting stuff out. So she was in a lot of pain, but she then reacted to the chemotherapy, and she actually died 4 times and had to be resuscitated. And that's when I got involved. After she has been resuscitated, she was in an awful lot of pain. So I did some work with her. She was still very much an inpatient at that stage. So I did pain control with her and worked for her sleeping, various other things, sort of well-being. We worked together over the months when she would then become an outpatient and so on. The last time I saw her was to actually assist her in 2 ways. One, to improve, but also to pull her back. Was to stop her overdoing her triathlon performances. So that was the last thing I worked with her on.
Yes, yeah, no, it's really, one thing for sure there, Gary, for our viewers, it illustrates some of the, the strength of human will, but also illustrates the reality of working in the environment you're in. I mean, the reality is you're going in there and you're dealing with situations that, day in, day out, and certainly not for the faint-hearted, so to speak. Obviously, especially the palliative stuff. And one thing I'm sort of going to get to is I was going to sort of ask you about the age ranges that you work with, and what are the age ranges that you work with, Gary, in terms of people seeing you? Is there what's the sort of range in age?
Full range. I mean, for legal reasons at my hospital, we're only allowed to do counselling with under 18s, so there's no hypnosis with under 18s. But essentially, anybody over the age of 18. I would say the majority of people I probably see are, because I think they're more accepted. I think more elderly people will try complementary therapies, but perhaps they're not quite as attuned to them. Or have less of an understanding. So I would guess that the majority of people I see are probably sort of mid-40s to sort of early 60s, typically. But it is the full age range from 18 through to 90.
Wow. And in terms of obviously, anyone at any age, it's sad to see anyone, suffer at any age. The only thing I would say is someone, for example, who's just starting out in life, if you've got someone who's sort of lived a full life, and it's devastating, no doubt. But if you've got like a 90-year-old who's lived a really full life and drank and smoked and traveled the world, and they could probably accept a little bit more than, say, an 18-year-old who's got not being ageist in the slightest, just sort of the reality. But in terms of yourself, I mean, do you ever get that? Do you get that situation where where you sort of work with someone, you kind of think, wow, life just isn't fair sometimes, or if
you do, yeah, yeah, yeah. Sometimes, yeah. I mean, you have to be very careful, and you have to have perhaps your own little bit of counselling or supervision sometimes to go over things. Yeah, I had one particular person that I worked with that I found quite hard. It was the most bittersweet session I've ever done, and I did some quite strange techniques to work with her. But that was probably the saddest one I had. I had a lady who was 29 years of age, and the story she told me was over the last 2 years, she'd lost her job because her company had gone bust, and she'd lost a lot of money. Her husband had left her for her best friend. She'd had 2 small children who were killed in a hit-and-run accident, and then she was diagnosed with terminal cancer. And so that type of thing, yeah. And I did a very interesting bittersweet session with her just before she died, which was quite a fascinating but quite a hard session. So that it can be quite difficult, and sometimes even myself, you don't think necessarily in the patient's point of view, which you should do. I mean, one of the things that brought it home to me is I'm quite a music lover of sort of rock music, and I quite like real ales, I quite like beer, and I go to the odd beer festivals. And I had a patient that was around my age, and we were talking about music. He was in similar sort of things, so over the weeks we built up quite an interesting relationship, and we were talking about a particular band, and I said to him, "Oh, did you know they're touring? They're touring the UK. Tickets went on sale this morning. You know, they're playing in 4 months' time, but tickets went on sale this morning. You know, you want to get in quick. You know, I've got tickets." And I was quite gobsmacked when he said to me, he said, "Oh no, when I go to concerts now," he said, I have to buy my tickets from ticket touts at the last minute." And I said, "Why is that?" And he said, "Well, there's no point in me buying a ticket for a concert in 4 months' time because I might not be here then."
Wow.
And that was quite an eye-opener.
Yeah, but I mean, in one sense, Garry, what I find interesting in terms of yourself, I mean, this sort of going off piece a little bit, but has the work you've done over the years kind of maybe sort of had impact on your philosophy on life, where you sort of see life as being, I mean, obviously, if it's written on the wall and you've got the diagnosis, prognosis, it's obviously devastating, but equally, you could make a case for, any of us in the world. We don't know. And I say this in the most sensitive possible way. Any of us could get up tomorrow morning and a bus, obviously that's not making light of someone being diagnosed, and, it must be devastating, and the work you do is phenomenal. But equally, you sort of start to think, well, actually, you know what? Life is precious, and you sort of start to think, well, none of us have any guarantees. I mean, there's almost like cancer has no discrimination in terms of it affects people, but also life in general. As it sort of your own philosophy in life, it sort of changed over the years through that, or you sort of, the way you see life. You mentioned there the guy with the tickets, where sometimes there's something you want to do, then do it type thing, rather than sort of putting things off. I mean, obviously within reason, it's not easy, and financially, and we've all got to work and that sort of stuff. But your own outlook on life, has it changed over the years?
I think it must have done. I think it's one of these things that's probably a gentle shift without realizing it. But yeah, certainly, it's one of the things I always sort of teach people when I'm doing my courses. The therapists, that you need to look after yourselves because you're no use to cancer patients unless you're psychologically sound and happy and so on. But the other thing is that at the end of the day, life is very, very precious. You don't know how long it's going to last, so go out there and enjoy every moment of it.
No, I mean, just that philosophy alone, I think in one respect, I can imagine for some people, not for everybody, but I think for people, some people who are experiencing, a condition, whichever that condition might be, it's almost like, okay, the perspective is, and sometimes you think, well, I'm going to get as much quality as I can out of life, just being aware. I mean, the reality is, we've all got a time frame. None of us are going to be here in this genetic form. We've all got a time frame, not to sound more, but that's the reality. But equally, in saying that, that's really interesting, because I think, as well as hypnosis, you have this sort of philosophy, as well, which is quite useful. probably without realizing it, where you sort of, you know, you can bounce off people and sort of see life what it is. Another question I was going to ask you, which I find interesting as well, is sort of getting the respect from the people in the medical field. I think is obviously an important thing. And many years ago, I mean, obviously you know yourself, and you know more than anyone, you know, pain relief and hypnosis. And I get a lot of calls for pain relief and hypnosis. People know me as a therapist for whatever reason, and they talk about pain relief. And one of the things I sort of said one time, you know, Garry, I was teaching a group of chiropractors. It was in Bournemouth, NLP hypnosis, and I went into what, you know, what we do for pain relief. And whilst I was doing that, I said to the guys, I think it's really important. This is my opinion. If someone comes up to see you for pain relief, to say, well, you know, go see a GP first. And I've been sort of criticised, I think, by a few people for saying that. But the reason I say that is because obviously, you know, I'm not a medical person, and I know how powerful hypnosis is, and I know how effective it is in pain relief. For me, I always say to the person who asks me, can you do pain relief sessions, you know, go see a medical person first and just do a battery of testing, because it could be a number of different things. You know, obviously, you know, worst scenario could be something along the lines of the tumor, and that obviously needs, not to say you can't work with a person, but obviously they're going to start, you know, a course of therapy with the medical people. Do you think it's really important as hypnotherapists to sort of, you know, from a safeguarding point of view, to make sure that we sort of, the hypnotherapist knows their role and what they're doing, and doesn't sort of cross that line into the medical field? I mean, are these sort of things that you talk to with the medical people when you're in the hospital, Garry, or?
Yeah, absolutely, and I couldn't agree more with you on that front. We are not medical professionals. We're there as an adjunct treatments, complementary therapies, and you're exactly right with pain control. You know, if I get a private patient, for example, that comes to me with a headache, the first thing I want to know is go and get yourself checked out by the medical people, because you don't know. You know, it might be a migraine, it might be a tumor. And if it's a tumour, you don't want to be covering up the pain from it, because it's there for a reason.
Absolutely.
So yeah, I won't work with pain unless it's been medically checked out first, because I think it's unethical to do so. But again, from my hospital point of view, obviously most of that, we know why the pain is there.
Absolutely,
yeah. Through treatment, they've had operations or and so on, or the radiation is burning internally, so we know why the pain is there, so therefore it's perfectly acceptable for us to work with it. But unless you know why it's there, and you know, you're seeing people that have been handed to you by other sort of medical staff, then no, you need to get them checked out medically first. I mean, at hospital, obviously I'm quite lucky, because if you like, I'm another cog in the wheel, so people that have been referred to me by the surgeons and by the oncologists and the nurses and that sort of thing.
Yeah, absolutely. That's really interesting point you made there, and I sort of adopt a similar approach as well, Garry, even for things like anxiety and if someone comes along, if they've got like a mood disorder and they say they're experiencing depression, the first thing I do is say, we'll see a medical person to rule out any potential organic conditions it could be. You know, not that I'm a medical expert, but you know, the modules I've covered and the course I've been on, you sort of think, well, actually, you know what, that it could be, just to be on the safe side, because these things like anxiety, these things like depression, there's multiple pathways. I think that's the great thing about what you do, in the sense that you're in that controlled environment where, you know, you're part of the team. And how does that feel to be part of the team?
Yeah, I mean, interestingly, even outside that environment, it's quite interesting. A lot of people don't know, because obviously I'm a private hypnotherapist as well as doing the Hypno Oncology. But one of my practices is actually in a GP surgery. And again, that come about because of my hospital work and my master's degree. So I was invited to go and practice within a GP surgery. So again, most of the people I see there is probably for things like anxiety and depression, but generally they have been referred to me by the GPs in the practice.
Yes, fantastic. I think that's really, and that's the sort of point I make. And you know, I was speaking to someone actually on a course I was teaching. It was a coaching course on the weekend. They sort of, you know, made a comment about, and the thing is, really, I think it's really important that, you know, we all work together and have good relationships with each other, in terms of, one of the things I stress with people is sort of know your remit, that's a really important thing. So, make sure you're sort of clear on what your remit is, but also what's really important to me is building a dialogue like you've got yourself with the GPs, where we're all working together. And I mean, I spoke to someone at a conference one time, and she was sort of talking about a course she'd been on. I can't speak for what it involved, because obviously it's only what she said. But if what she said, some of the things that she was saying was said on the course, I felt, in my opinion, unless the teacher had a medical background, they sort of talked about had an opinion on medication for depression, that sort of stuff. Well, that's not my area. I said, I can't comment on that, I'm afraid, And that's the sort of dangerous thing, I think, sometimes. A little bit of knowledge people see and these days, the internet can be a great thing. Great professionals like yourself who know their stuff on the internet, but equally it's open for everybody to have some sort of opinion. And there's so much out there, that's sort of scary in the sense that, I'm like yourself. I sort of look for the scientific rationale for things as well, to look at that. But I guess one thing that highlights with what you do is building these sort of good relationships with people. Is that something that you sort of talk about in your course or the workshops you run, Gary, building relationships with other professionals in the field? Is that you see?
It is, yeah. And one of the areas that I couldn't stress enough from that area is again, some of the medical professionals don't like us still, for obvious reasons. I don't think we help ourselves because the industry is unregulated, and I see so many people online asking questions and making such sweeping statements. I mean, I had a disagreement with somebody on Facebook not so long ago where somebody asked for advice on dealing with borderline personality disorder. And again, it's an area I've done a lot of work in, and I get GPs send me people for that. So I gave some general advice, and somebody else popped up and said, "Oh no, it's easy. I can cure," was the word that I used, borderline personality disorder in one session. And I went back and said, well, first of all, we don't use the word cure. We just help and facilitate. We don't cure anything. And secondly, what sort of approach do you work with, and where's your evidence base that you've made the difference? And the guy came back and he said, I'm a curative hypnotherapist, not a general clinical hypnotherapist. So I thought, yeah, okay. And he said, he said borderline personality disorder. He said it's simple. It's a genetic switch that's in the wrong place. So he said, I do hypnosis. I switch the genetic switch back to the right place, and the problem goes away. So I said, so where's the evidence? Where's the evidence base for that? And he said, the client tells me they feel better. Now that's the sort of thing that we're just not going to get taken seriously at all.
No, that's a great point you've made there. That's a great point you've made there.
And one of the things, particularly for me, in a hospital environment, is the first thing you don't do is, when you talk about hypnotherapy, you don't use any airy fairy language. You don't talk about past life regression and all this sort of thing. We talk about sort of guided visualizations and relaxations and analytical work and so on. So you don't do anything that sounds airy fairy. And to me, it's also very important that and somebody misconstrued this from an interview that I made. I say it's very important that you use medical language in a hospital. And somebody pulled me up and said, no, you're not a doctor. Why should you be using medical language? You'll just end up looking stupid because you don't know what it's for. And what I actually mean is in particular in hospital, and particularly in a cancer unit, because I'm just another cog in the wheel, a patient will come into me with their hospital notes, and they'll come along and say, well, I've got grade 2 this, stage 4 this, I'm on tamoxifen for this, I've had this treatment and whatever. And if you look at them blankly, there's rapport out the window, they think you're clueless, you don't know what you're doing. So you need to have the same background and the same understanding of the terminology of the doctors and the oncologists and the nurses.
Absolutely.
And if you have the same understanding, and again, I teach the background to cancer on my courses. We will learn all about formation, grading, staging, treatment, side effects, all that sort of stuff, so that people will have an understanding of that as part of the journey. So they'll be able to discuss that with other medical staff or patients.
Absolutely. I think that's interesting, and in a similar way, I do a lot of work in sports. Gary, and when I'm speaking to the physiologists and the physical conditioning coaches, then I have enough knowledge to sort of speak to me in their sort of language, which is important too. We're going to work with them, mentally, through mental skills, making sure that things are in order physically, because that's obviously in sports a big thing. And you can be as mentally strong and confident as you want, but if you haven't got the physical side in sport in order, it's a big thing. And I think for me, it's really interesting. And you know, I have I mean, I have like you know, a foot in the spiritual side. I do, you know, as much as I sort of I'm very much into science. I have an open mind. I think science has taken us so far, and but like an energy of appearing, there's a lot of things that we don't know. So I'm open to people sort of with ideas and sharing ideas, but I think the important thing is to sort of like, you know, make sure that you know, there is some sort of rationale behind it, or a bit of an understanding, you know, behind what's going on. And you know, certainly, like you mentioned, regression, and I use regressive strategies, but a lot of them are based on reappraisal. And when I take someone back, they can go back as far back as they want to go, but equally the end goal is to sort of reappraise the emotion, in adverse to sort of, you know, suggesting that there is or there isn't. You know, the science background in me tells me that, you know, this is there, but the spiritual side of things, well, who knows? But I think anything we do is really important, that we do have a rationale for doing it that's sort of robust. And interesting that, you know, the borderline, you know, that Marshallina and the DBT, she would have been probably, she had heard someone speak like that, she probably would have been, you know, spinning feathers. Really, it's fascinating how people sort of come up with this sort of stuff, and that's why I think it's important for us as hypnotherapy to go forward. I think for me, you know, some great people like yourself do some great work. Obviously, Adam, that, you know, the convention is doing great work, and that's, you know, the convention for me started off as it meant to go on. It was obviously, you know, Nick had done a great job before, and you know, and the convention's out there, and I think for me it's important to sort of, you know, keep following that work on and building on it. And whilst I do enjoy, like he says, I sort of enjoy the more conventional styles of hypnosis and people having their own style. I still think it's really important that we sort of keep going forward and sort of get involved in research. And yourself, you mentioned before that you sort of your own independent research tied into the into the masters, but have you sort of carry on reading research? And I mean, obviously,
I do, yeah, and particularly again the area of PNI, you know, the psychoneuroimmunology, which again is another topic we could go into for ages at some stage. But because again, it's another one. When I'm at conventions, I actually do a 1 hour talk on PNI alone, as well as Hypno Oncology. So I'm very fascinated in all that, and just all the advantages that hypnotherapy can have just with the cancer journey. I mean, you know, one of the reasons that the hospitals are now picking up on it is there's a lot of advantages with Hypno Oncology. We get reduced costs and things, and people say, well, how can you reduce costs by using Hypno Oncology? Well, you're getting less stress for frontline staff, because they're now not dealing with the anxieties, they're not dealing with the stresses and the fears and the phobias, because we are. So they're less stressed. Medication's potentially more effective. I found that with pain medication particularly. Therefore, if there's more pain control, there's better patient well-being. They're happier, they're more empowered. You're giving them coping mechanisms, and generally you find there's a fast recovery. So it's freeing up bed space. So if you can free up bed space, you can take stress off of frontline staff. You'll get less sickness and so on, and you're reducing medication. You know, there's lots of reduced costs there.
No, absolutely.
So, you know, hospitals are now sort of picking up on that.
Absolutely, no, yeah.
And you know, realizing that the area of psychological and social care is the way, you know, to go forward, really. And that's why I'm trying to sort of push the idea of Hypno Oncology. In particular, what I've actually formed is an association of Hypno Oncology practitioners, and the idea of that is to ensure that there are a body of people that are specifically trained in Hypno Oncology, but to a level that I know they're competent, and they will operate in an ethical manner by a set of guidelines and protocols and things.
Absolutely.
And that's now starting to get traction, because we've now got practitioners all over the world that are actually doing it. And because we've now got practitioners all over the world, we've got trainers all over the world. So now training is carried out worldwide, which is great. So, you know, you can probably find a Hypno Oncology practitioner everywhere.
Fantastic.
So certainly I know they're available in the UK, in Europe, the USA, and the Middle East, and again there are trainings this year that people are doing out in Europe, the USA, Canada, and all over the place. So I mean, it is actually getting out there.
Yeah, absolutely. And I think the good thing is that obviously the experience that you've got in the field as well. So I mean, that's imperative. Obviously, you've sort of, you know, worked with a lot of people over many years, and you've got a lot of experience, which is really important in terms of gauging the sort of level of ability you'd want someone to be in that environment. You know, I mean, I interviewed someone a while ago. It was quite interesting. A couple of years ago, I actually I stumbled upon her talk. Her name was Sandy Edwards, and she did a study. It was more like spiritual type stuff, and it was, I think, in Birmingham somewhere. But I mean, the study was really, really, you know, really fascinating, and I think it was based on irritable bowel syndrome and the effect that, you know, my own suspicion was, I think just having someone empathic there made a big difference. But, you know, it wasn't the study I was involved in. She was just telling me about it, and it was really, really powerful stuff. But obviously, you know, I stress like you've stressed that, and the work that you do is sort of adjacent to the situation. But I think for me, there's so much that, you know, we're learning now with modern technology and all the technology we've got these days. I think in the next 20, 30, 40 years, there's going to be a lot more. I think the technology is sort of giving us a better understanding of things like, you know, MRIs and you know, all the stuff that we've got now that we didn't have in the past is really fascinating for me in terms of going forward. And yourself, you know, I mean, obviously, you know, you're one of the people at the forefront, if not at the forefront of the hypno oncology. Sort of, you're out there, you're doing it. You know, where do you sort of see it going yourself, Garry? I mean, in terms of where you are now, you've taken it a long way, and you've been in the industry for a long time now. I mean, yourself, where do you sort of see your vision? So is it more the same, getting out there, speaking, and
yeah, I mean, the way I see it is sort of having trainers worldwide, so that we can get it out worldwide to everywhere. As I said, I mean, it was great. I got invited out to Bahrain a couple of months ago, but they were very interested in the Middle East. And now we've got people that are doing trainings all over the world. And I'd like to get that out further, so that we can get trainings all over the world, so that every hospital, every doctor's unit can have somebody that can help cancer patients. As we know, it's 20% of the population, so there's an awful lot of people to work with. It's a big market. And I guess further on, sort of dream-wise, I think on that front is I would like to perhaps change it slightly to be able to teach non-hypnotherapists. Now, it sounds a funny idea, but I would quite like to get in the idea of teaching it within hospitals and things like that. Actually teaching sort of from a basic level for doctors, surgeons, oncologists, nurses. That I would quite like to do.
Absolutely, and I think that the idea of sort of teaching existing professionals, you know, whether they be, you know, psychiatry, psychology, whatever the background they have, I'm sure it's another variable, and their understanding of the mind as well. One would think that you know, they understand the process in terms of going forward. And I think one thing for sure is you know, it covers a variable, so to speak, in terms of, you know, what you can do. I think there's, you know, in that situation, one could only imagine that one would want as much help that they can possibly get from as many, you know, credible areas as possible. Really, obviously, you know, the journey of being in that situation, no doubt, is frightening and can be a lonely journey. But having people in your corner can only be a positive thing, one thing. But it's been fascinating, Garry. I mean, we would probably sort of carry on speaking, but I found it really interesting what you do. And in terms of your contact, you sort of contactable in terms of the Cyberland, your contact. How can people get in touch who are watching the show, who are interested and intrigued?
Yeah, for the Hypno Oncology stuff, we do have a Hypno Oncology website. So, and that gives details of all about what Hypno Oncology is. It talks about the training, background to it, and so on, courses and talks coming up. And the website for that is www.hypno-oncology.com. So again, www.hypno-oncology.com.
No, that's fantastic, and no doubt we'll sort of catch up at some point at one of the conferences again. Anyway, but it's been a fantastic.
I seem to be at a few this year.
Yeah, I think we were definitely overlapping. You know, a few of them. I think it's New York, Amsterdam, and I've put my name in the hat for London too. We'll see what happens there. So
yeah, I haven't heard back from London yet. Yeah. I'm doing two so far here. I'm doing a training course in Birmingham in June. That's the only Hypno Oncology one in the UK this year.
Sure, yeah.
In June, but I know I'm talking at there's a new conference, Hypno Meetups Live in Birmingham in May.
Okay.
That I'm talking at, and I'm also talking at the Hypnotherapy Society conference in Coventry in April.
Okay,
So
fantastic.
the ones over here, but yeah, all the others are whizzing around the world.
Yeah, no, exactly. I'm sort of in a similar boat to yourself. I've sort of put my name in for a few different conferences. So, no doubt we'll sort of bump into each other at some of them anyway. But it's been a pleasure having you on board, Garry. I found it really, really fascinating myself. I'm sure the viewers have found it fascinating, and do email, Garry, if you've got any other, questions in the area that he's spoken about. Really, really fascinating work that you're doing. And I think that for me, the sort of work that you do is where, if we want to take hypnotherapy forward, it's really important in terms of building its credibility, building relationships like you've done with people, moving forward. But thanks again, Garry, for coming on board. I've really enjoyed it. No doubt the viewers have too, and no doubt we'll sort of catch up soon at some point.
Yeah, thanks very much for the chat, Jimmy. And again, I will see you around the world later in the year.
Will do. Thank you.